Hello. I got a call from one of the DM nephrology resident. He told his thesis was rejected and he was searching the topic for the last 1 month and he could not get any topic, and there was no proper guidance from the guide, or the guide probably told him to select the topic on his own. He came to the point that he was thinking to leave the course because he thinks completing the thesis is a very big task. I thought of answering him on phone, but since similar to him, any one of you or any one of the first year resident might be having the same situation. So I thought of uploading this video. So during the DM residency, the thesis topic might look big. Yeah, completing the thesis might be appearing as a big task. Many students get stressed up whether they will be able to complete it or not, whether they will be able to get the degree or not. When we were doing DM residency, we also had similar doubts. But listen to me, once you complete your DM, you will come to know how small that thesis part was in your life. And you even won't think about those difficulties once you complete the DM. And you will think why I have taken this much stress about thesis during my residency. Like that you will be thinking. So don't worry, the thesis will be done. And how to select the topic? See, selecting the DM thesis topic, you have to take into consideration what was your guide's choice. On a broader note, which topic you want to do under, for example, AKA, CKD, diabetes, whatever it may be, you have to ask them. Suppose if they are open to any topic, whichever is feasible and easy to do, because apart from the thesis work, you will be having your clinical posting, management of the patient, academics, seminars, and whatnot. That is, you are already overworked. So your thesis topic have to be simple. Another commonly encountered question is, there are some institute which allow the student either to do the thesis or publish to review article. Publishing review article is bit difficult than doing the thesis. At least that is my opinion. Why? Because doing the thesis or any research work is bit easier if you know it. And in the beginning of your DM residency, since you are not exposed to the subject in core, yes, of course you will be having difficulty in topic selection. To simplify that, you can plan some studies related to outcome. For example, outcome of AKI patient in the hospital in northern India or south India, wherever you are doing your residency. For the 6 months period, you can take and you can submit a outcome trial on what happened to the AKI patient. You can classify it as per staging, epidemiology, parameters. This will very well be published in India or outside also. Another example is outcome of UTI. Any disease you can take just for a period of whatever the thesis time allowed in your institute. Try to take it as an outcome trial, and as per the previous studies, you can select the subject numbers. Outcome of diabetic nephropathy in your center. CKD stage wise outcome. Those who are on dialysis, those who are not on dialysis. Any outcome trials you can plan. The more example with respect to CRBSI, SLA outcome, any glomerulonephritis you can take. For example, IgA nephropathy, what was the outcome over a period of 3 months follow-up? Because in super specialty, you have to do only prospective study, not the retrospective one in most of the institutes. take it. This one set is related to outcome trials, which is very simple. You have to have a follow-up only. The second set is comparison trial. You select two parameters and try to compare it. For example, IgA nephropathy, you take 30 patients who are on conservative management and 30 patients who are on immunosuppression and follow them up and see the response for 3 to 6 months, whatever the period is allowed. So a particular treatment, particular drug or a particular intervention can be compared. These are the comparison trial. The number can be minimal, 30 to 50 as per the previous studies. AKI, those received hemodialysis, those who didn't receive hemodialysis, how is their performance over 3 to 6 months? These kind of two groups can be allotted and follow-up can be done, which is also somewhat easier kind of study. Apart from this, any other disease, you can take it for any particular entity, for example, even diabetic nephropathy. CKD patient who are on erythropoietin, who are on darbepoetin, somewhat a comparison type you can do. Hypertension patient who are all on beta blockers, who are all on some other drugs. If the drug study is allowed, you can do a simple comparison for a short period of time. This kind of study you can plan. Next comes some investigational parameter and the outcome. These are all the set of studies where investigation will be compared with the outcome. Any blood marker like procalcitonin, CBC, you take a particular marker and compare it with the outcome. For example, IPTS level in CKD particular stage in northern India, what is the trend? Or IPTH and incidence of MI over a period of 3 to 6 months. Or lipid profile in particular stage of CKD. You can compare 2D echo parameters between CKD stage 4 and CKD stage 5. These are some preliminary type of study which is easy to do also. Probably this can be published in Indian journals because internationally there are so many studies which are already done. Very difficult to publish in the international level, but at least for the thesis and Indian level publication will be done. Investigational parameters and the outcome. Another set is particular to dialysis. In a dialysis patient, you can see the blood pressure, impact of home BP monitoring and the dialysis unit BP and the outcome. And you can divide the patient into two groups, those who are on beta blockers, those who are on calcium channel blockers. Or you can monitor the outcome, those who are getting co-current dialysis and outcome in patient who are getting counter-current dialysis. Volume status assessment is suppose a bioimpedance machine is there, very easy to do. You can compare between bioimpedance and the lung ultrasound. If your institute is equipped with all this, very easy to do. Yeah, clinical assessment. Clinically, how much clinical assessment is helpful in comparing it with the bioimpedance value? What are all the values? You can easily do these kind of dialysis studies. Very easy to do because the follow-up is very easy. Any patient will come to the dialysis unit. Or you can compare patient who are thrice weekly dialysis and the outcome on patient who are on twice weekly hemodialysis. Another example is patient whose dialysis initiated with AV fistula, whose dialysis initiated with the catheter. These kind of simple studies you can do over a period of 3 to 6 months. Incidence of CRBSI in your dialysis unit. These kind of publication you can think of with respect to the dialysis. With respect to transplant, you can plan on incidence of infection, what kind of infection for a period of 3 to 6 months. Reason for hospital admission in a tertiary care center in India. What are all the CNI target the patient have achieved? What is the tacrolimus dose in your center the patient is on for 6 months? Incidence of UTI. What is the culture commonly grown in the post-transplant patient? Simple thesis you can make in the transplant and dialysis. which can be easily published also. Okay, these are all the examples I have given you. With this, you can easily formulate your thesis topic. But many juniors will have some doubts, sir. My guide is not okay with this kind of simple topic. He want to have some more, whatever the topics I have told. The student was saying, I have given this, but the guide rejected all of those. Then how to approach in those conditions? See, if you go to any guideline, the guideline people themselves give what further study they require. For example, this is the Kidoki vascular access guideline. You go through the PDF. At the end of the topic, there will be one column called future research. What research they want at the international level. Even my thesis I selected from this one only. I went through this guideline. In the future research, they have given comparison of Doppler and fistulogram. There is no evidence, though that is what the study I have did. So you go through topic chapter wise, and end of each chapter you will be having. See, the role of balloon assisted maturation of AV fistula need to be studied further in RCT. Not compulsorily it have to be like this. You can modify. You will get the idea from this. And these are all the articles which can be easily published at the international platform. You can quote this Kidoki guideline that they want this kind of research. So you planned a smaller research for your thesis like that. Very well acknowledged in the conferences also. You can easily publish it. So you can go through for after the each chapter there will be one further research topic. You go for particular topic of interest, whatever your guide gave, go through it and go to the last chapter. They will give given further research. From there you can select. This is another example, AV fistula clinical practice guideline. See, here also they have given the suggestion for further research. They have given lack of evidence proving the superiority of surgical over endovascular treatment of fistula thrombosis. Even though this topic is difficult, I just showing this as an example. Go through the particular guideline and you will get a lot of further research questions. This is another, or go to Kidigo guidelines, download a particular guideline PDF, go to the chapter wise explanations and find you will be having some research recommendation. For example, they will be focusing on particular topic and what they want. For example, if we take CKD, there will be some controversy, question type of column will be there. A minute, I will show you. See, for example, they have given area of controversy, confusion or non-consensus. There is a debate on the timing and use of specific diagnostic criteria for peripheral arterial disease in patient with CKD. So you can take this one also. Comparison of Doppler parameters in CKD patient, like that you can take. This is a simple example. You can go through any other guideline and go through the further research recommendation, which will be easily published at the international platform. Okay, this is done. And how to select the population size? It will be based on the previous study. If no previous study is available, considering the OPD load of your institute, you can plan it. I hope in those kind your guide should be in a position to help you, because once you complete DM you will have idea about how to select the patient, what are all the current practice guidelines, what are all the things which are lagging. So at least in the beginning of your journey, I hope this video is helpful. For example, I will show you one thesis publication which was published. What they have told, epidemiology and outcome of AKI in critically ill patient in a tertiary care center. They have published in JIPMER, where they have taken a patient and assessed the outcome like this. You just put it in Google, you can download the article which is free, and you can conduct these kind of study in anywhere, whichever institute you are in. Very easy to get the patient. Just you have to collect the clinical data. In the follow-up visit, what happened to the patient, like this. And whichever study you plan, put it in Google. There might be some similar past studies you will get. With that you can plan further. I hope the student who called me have his doubts cleared. So good night for today. Thank you.